Okay, so we were just doing ankle dorsiflexion, and we looked at both sides to see how they are. And then what I like to do is I always like to check the extensor hiatus brevis tendon. Oop, you okay?
Yeah, I sneezed.
Oh, okay. Okay, so I just check for atrophy here, because many times that's the first sign you'll see of an L5 radiculopathy. And then I check long toe extension. So bring your toes up and don't let me pull them down. Just the big toes, hold tight, and I'm looking for asymmetry and weakness, okay? So we did that, resisted great toe extension, ankle, and then we can do ankle eversion. Pull your ankles out, both of them out, and hold tight. And we can check them at the same time for asymmetry of strength and movement. Okay, so that will that'll be all we can do on our supine testing. Now, the next thing we'll do is our sitting testing, and I think Julia, maybe sit this way.
Okay.
I like to do the hips again this way. Oh, I'm sorry.
Me too.
Okay. Now, bring this knee up toward your chest. You can test it again. Hold tight. And we can do check it for asymmetry. Hold tight. Now straighten your knee out. Hold tight. This one. Hold tight. Okay. So we can test those. And then we can test for a resisted hip abduction. Spread out. Now spread in. Don't pull them apart. Hold tight. Hold your knees together. Okay, good. And if there's weakness there, you're going to see it. And many times you will see it with a hip arthropathy or hip problem. Okay, relax now. So while I've got her here, I will do my reflex testing for problems in the we have to, if in your history the patients are complaining of functional problems, then you can do upper motor neuron tests, which we really have, there's other ones to do. All right, but the first thing we'll do is we'll do our patellar tendon testing. She's a little hyper on this side when I compare the two. But she has symmetrical Achilles reflex, symmetrical knee reflexes. So these will be, what you're looking for is asymmetry. And if you have an L4 root problem, you many times are going to see that atrophy in this quad, and then you'll see a deep pressed reflex here, or when we did our heel toe walking, couldn't walk on our toes on our toes on this side. You check this reflex, it's down. Those all fit together for L3, L4, L4, L5, S1 radiculopathies. Okay, so my screen test. Okay, so sitting we did. Okay, so now we want to do prone testing. And lay on your tummy, Joel. And I like to do the hip now in this position. It's very simple to do. That is, all we do is bring the knees up, and then we rotate the legs apart, like so. And they should be symmetrical. If you, in a typical hip arthrosis, you will see something like this, where you just can't get the rotation on this side, and this precipitates the pain in the groin and or the knee, depending on their pain complaints. Okay, so the other thing you do in the prone position, relax down flat. You want to make sure they're flat on the table, and you look at the gluteal skyline. And all you do is you come down here, you get down low, and you look to see how the gluteus maximus are coming up, and if they are symmetrical. You look for flattening on one side. If you have flattening on one side, you will probably have a turgor problem, whereas if you palpate one side and then the other side, there's a big difference. And many times, that's the first sign you'll see of an S1 radiculopathy. where there's a gluteal change in either atrophy or tone, gluteal tone. Okay, so you look at that, and then beyond that, you can do some, you can do a spring test on the lumbar spine, and this gets into more segmental involvement in treatment. You can do it, and it will just kind of confirm what you found out on the rest of your exam. And all you do is you come into, you find the spinous process, you put your finger on it, and then you put the heel of your hand on it, and you spring on it a little bit. And when you come to the site of involvement, that hurts. So it's a pain provocation test. Okay? So that is the spring test and the gluteal skyline. Make sure I didn't forget anything. The only thing we really didn't do is resisted knee flexion, and I usually do that sitting. You have to be careful when you do. Oh no, wait a minute, I did do femoral nerve stretch too. The other thing you do prone, let me get a little drink here. Typically, with an upper lumbar problem, you know, we talked about the sciatic nerve and the positive straight leg raising. Many people call this reverse straight leg raising. So that when you bend the knee up, relax. Are you okay, honey?
Yeah.
When you bend the knee up to 90, that, you know, nothing should happen. Now what occurs here is you have the lumbar plexus forming the femoral nerve, okay? And the femoral nerve goes around this corner here, down the leg, and all the way to the end of the quad, okay? So that when you bend the knee like so, you're causing this to get on a fairly severe stretch, okay? So that what we call a positive femoral nerve stretch is when the patient has pain before 90 degrees of knee flexion. That's positive. But I like to look at it in relation to the other problem. I might have pain right in here, deep pain, and then when I get to the other side, nothing. Well, that's not normal, but it wouldn't be considered. They don't consider it positive unless it's positive from before 90 degrees. But I consider it positive if it's asymmetrical. You can also create more stretch on it, and I don't recommend you do this, but what you can do is stabilize the pelvis and extend the hip. Now what are we doing? We're pulling that nerve even harder. We're stretching it to as far as it can stretch, and now we're going to make it go further. So you can accentuate the problem. Now with a classic L3, L4 radiculopathy, I can tell you right now, you'll never get to 90. It's just too much. It's very painful for them. And that would also go in concert with weakness of the quad, weakness of the hip flexors, depressed knee jerk, and that type of thing. So you're dealing probably with an L3, L4 radiculopathy. Okay, so that, make sure I showed you how to do everything. Version. Femoral nerve stretch. Okay. The only thing we didn't do, you can sit, Julie. Careful. It was pretty solid.
It's hot.
Hard too, huh?
Yeah, I was going to say that, but I don't want to be complaining.
Right. I don't want you to complain.
No.
Okay. Now, you can test, you know, bend your knee up, honey. Bend it.
Bend it.
Hold on. Don't do
Bend
anything.
it back.
Yes, I want you to flex your knee like this. You can't tell people to flex. They have no idea what that means.
Yeah.
Relax, relax. One of the things you got to be careful in hamstring testing, it's very common to get severe spasm on hamstring testing. So you just tell them to pull back, bend your knee backward, and relax. And then bend your knee backward, and relax. And don't overdo it. You overdo it and you're going to end up with a spasm of the hamstring, sometimes very difficult to relieve. Okay? Okay. Now, I would suggest you also do vascular testing, especially in your flexion principal patients, and we didn't do that, and I'll show you how to do that. Lay on your back. So the first thing you do is, in your vascular testing, you just look at the patient's toes. Do they have hair on their toes? If they don't, is there a symmetrical pattern of that? If they don't have hair on either side, it could be, it could be sugar, stuff like that. But you note that. So you look for trophic changes in the legs. All right. Now sometimes you can get this claudic pain behavior can come from orthopedic issues, or it can come from vascular issues. So relax. The first thing you can test for is the femoral pulse, and it's right in here. If you feel for the anterior superior spine, and then for this pubic area, and you can press here in the inguinal, right over the inguinal ligament area, and you can generally feel a pulsing of the femoral artery. Okay. Then you can also come down into the knee, compress the back of the knee a little bit, and feel for a tibial pulse. And then you can come down and just behind the medial malleoli, you feel gently for the posterior tibial pulse. She has a good one. And then the anterior tib pulse, what's the dorsalis pedis? Bring your big toe up, now let it go. And if you go right beside that tendon on the foot, gently, that's generally where the dorsalis pedis is. And you can feel a pulse there. And I feel her pulse nice. It's a nice pulse. Okay, so that's a general vascular test for lower quarter screening exam. Some orthopedic problems do happen in concert with vascular problems. And some of these things, when you can have tumors and stuff like that that cause a problem with your vascular test and also cause back pain. So you have to kind of put that stuff together. You can sit up, Julie. There's some other sacroiliac tests that Kenny hopefully will show you in one of his sections. Okay, that's it.
Okay.
What's the tip on here?